Well, I want to welcome you to the annual State of the Health System update. I'm Tom Nesbitt. I'm the Associate Vice Chancellor for Strategic Technologies and Alliances here at the Health System. I also want to welcome those of you who are watching via video in the second lecture hall upstairs. I want to let all of you know that this is being recorded, video recorded, and it will appear on the Insider. So soon after the event's over. Well, last week I happily concluded my time as interim Vice Chancellor for Human Health Sciences and Dean of the School of Medicine. And I want to take this final opportunity to thank all of you for your hard work and your support. I've been here over 25 years, and the more I learn about different parts of the health system and meet more of the people who work at the health system, I'm just continually impressed with the commitment and dedication of the people who work here. It really is all of the people who work here and study here that make up the health system and really define who we are and really make us the outstanding health system that we are today. So again, I really appreciate all that you do. It's my pleasure to introduce Linda Katehi, the Chancellor for the University of California, Davis. Linda became the 6th Chancellor of UC Davis in August of 2009. As the university's Chief Executive Officer, Linda oversees all of the aspects of the university's teaching, research, and public service missions. I've had the opportunity to work with her more closely over this past year. And I'm not only impressed with her attention to the health system issues and her knowledge of the health system, particularly this past year, I'm really impressed with the tremendous time and the effort that she spent in the search process. She met with countless community groups, faculty groups, staff, students during the search process. She was over here all the time. I would see her every evening coming in, working on the search. And as you will see, her hard work paid off. She was able to work on getting us an excellent Vice Chancellor and Dean. So I want to thank her for that. And finally, from a personal standpoint, I want to thank Linda for her support of me during the time I was in the interim role and for your wisdom and all of your support. So without further ado, our Chancellor, Linda Katehi.
Thank you, Tom. Thank you so much. And thank you all for giving me the opportunity to say a few words here just before the very important and first for your Dean and Vice Chancellor State of the Health System address. First, I wanted to say a few things about Tom. I have many more things to say and be proud of from what Tom was able to do this past year than I believe I have for anyone I have worked with in my whole career. I also have to say that Tom was concerned in the beginning of taking this role. Obviously, he was very engaged and invested in the telemedicine program. The building was finishing from construction. There were a lot of things happening, good things happening in the program, and that was a major undertaking during a very critical time of a transition. And I have to say that Tom has done an amazing job in this role. But beyond that, it's not just the quality of his work, but what I came to see is that his commitment to the health system and to UC Davis. You will not find too many people who give themselves and their time and with that put risk on themselves and their own reputation in such a way so they would only provide the best service possible for the health system. And that's what Tom did, and I thank you, Tom. Both Ralph and I thank you so much for doing this, for being such a great colleague. And I hope that will continue for many more years to come, to stay connected with you and work with you. But I have truly enjoyed our collaboration, and I have truly appreciated the great work that Tom did for the health system. So please, thank you. So a few things to say. Obviously, the hard work produced a great result. And I was just telling Julie that my stress level has gone down so substantially that I came to believe there is a great life after all as a chancellor. The life of the chancellor is not only horrible, but I also, on a serious note, I am so really hopeful having such a great leader and the support from Tom and the rest of the team that really has come together to support your new leader. One person cannot make a difference. It's one person supported by the community that can make a difference. And so, and I'm very pleased to see that all of the right conditions are in place for Julie and her leadership team, and with all of you to work together to really bring the health system to the next great level. I was also delighted to give the same state of the campus address to the Senate on Monday. And you will find it on the web, so I'm not going to say too many things other than our university is doing extremely well. I could not say that for 2 years even ago. Definitely, I would not say that 4 years ago when I joined the institution. But this past year, we have every indication in place that now we are ready to move forward. We have addressed a number of financial difficulties we had in the past. We have brought great deal of stability into our finances. The health system is doing extremely well. And you're doing well, the system doing well is so critical to UC Davis because the health system is close to 45% of UC Davis. So I will never be in a position to say that UC Davis is doing well without the health system being in the same position. And so there is a numerous list of things that I could just point to, but the one thing that I'm looking for really is a better integration between the health system and our campus, because there is so much we can do together. So the campaign on One UC Davis really means a lot to all of us, not just the integration between the health system and the Davis campus, but also integration between the various disciplines on the Davis campus, because there have been gaps between the various colleges. And our opportunity as an institution to differentiate ourselves and really move forward and become the UC of the 21st century is in our ability to work at those intersections. And I have been very pleased to hear that in the new program that the provost announced for these new faculty positions that will bridge the disciplines, there have been 17 proposals or so. So that says a lot, and I will stop here. Thank you all for being here. I'm looking forward to hearing the state of the system address. And again, please enjoy the rest of the year. This year is great. A lot of opportunity coming forward. Thank you very much.
Well, it's my pleasure to be here today, and I want to thank Chancellor Katehi for her leadership and her commitment to the health system. One of the reasons I came was when I met her great ideas, her ability to see the big picture, and the thought of One UC Davis. Now, there is some truth and some myth about the initial interview I had with UC Davis. We happened to be in northern Minnesota at a wedding of a friend, and we were perched in a hotel room, that is the truth, with a portable computer that sometimes was working. And as my husband left so I could do my interview, I made one mistake, and that was not to put on the front door for housekeeping not to enter. And right in the middle of the interview, as I saw all the search committee down the line and Linda at the end with Diana, there was a knock on the door, and the screen had gone black a few times already, so I didn't want to move, and I just said, "1 moment, please." And I said, "You could come back later, please. I'm sorry, I forgot to put it on the door." That is the truth, and luckily the computer kept working, and I do think they were impressed that I didn't lose my cool with the fact that little did they know the screen had blacked out a few times anyway, so that was the least of my worry. I really was impressed with Linda's commitment to the search. It was swift, it was public, it was really amazing, and Diana Farmer helped lead that, and that was wonderful. And I've been getting to know the Chancellor and her leadership team over the last few months. Provost Hexter, the fellow deans, Dr. Michael Larimore, Helene Dillard, James Hildreth, Harris Lewin, and Enrique Lavernia, all just amazing people. And I see so many avenues where we can coordinate and collaborate. I'm inspired by her vision of UC Davis and her great ideas and her enthusiasm, and we're hoping to partner with that as we go forward. We have really some great ideas about population and global health, environment for our staff, students, faculty, and patients, and then really augmenting education as well, and really being ahead of the curve on how we're going to teach us all to do better. I also need to thank Tom. His help has just been vital for me to get up to speed. He led the health system, as you all know, for 9 months. He led the transition process, and I began meeting with him and Fred back in October, November, twice in January. So when I did come, I felt pretty at ease about what went on here. He's a great communicator, and he's really done a wonderful job informing me about what's important to all of you here at UC Davis. The faculty, staff, and students are just wonderful here, and I want to thank you for really making me feel welcome. I'm 7 days old now. I've been here for a whole week, and I really feel the warmth and all your energy and your willingness to tell me about what things are important to you, what things need to be improved, what things I can help you with, and how to help you accomplish them. There's many of you in the audience that have helped me do things already. Some students that I've lunched with, nurses and physicians that I've met. I've already been up to the operating room because I will be doing some surgery. I've been there. My retractor has arrived, which I need to do one of my procedures. And then I have met with a few chairs. I'm traveling out to see chairs in their environment. I've met with Dr. Hales. Dr. Farmer took me all around the healthcare system. And I was over in the outpatient building this week with Dr. Manis. I've also been over on the UC campus in Davis and met with some of the researchers. I spent some time with Pete Calla yesterday seeing his physiology laboratories. I've met with Nancy Lane, and actually just this morning was over at the Stem Cell Institute meeting with Jan Nolta and that group. Very impressive places, and I'll continue to do that over the next 2 to 3 months. I even already met with Congresswoman Doris Matsui already. She was in my office last week, and it's very special to be in the Matsui Lecture Hall today as well. So the health system is really starting to feel like home. And speaking of home, I do own a home. We bought a home online. That is a truth. We did buy it online. However, you do have a few days to come into town and make sure that's that. Carly's in the audience here who helped us do that. And we love our new home when we're moving into that. As many of you know, I trained at UCLA. I worked at UCLA as a division chief. I worked at UCSD. So being back in the UC system feels like home. Our neighbors are wonderful in Sacramento. They brought us cookies. They've been over to our house. We found a dog sitter already, so life is good. My husband is here, and I do have one child that lives in Los Angeles and one in San Francisco. They've already visited the child from San Francisco and his wife, and we have a grandchild on the way in August, and that's actually quite a shocker, and I'm getting used to that. And our last child, Taylor, is a freshman at the University of Maryland, and another miracle, he's decided to spend his spring break here in Sacramento. So we're a destination where if we had been in Baltimore, I think he would have gone to Florida. Our dog is very happy. He had to be shipped across the country, but Brett has come into his own and really thinks good weather every day is fine. So I'm very glad to be here at UC Davis, and I'm looking forward to meeting and listening to all of you, students, faculty, staff, and the community. I am a researcher. I'll be doing some work at the VA because I run a national clinical trial on aneurysm repair. I also will do some thoracic outlet practice. I'll be operating here, as well as I'll have an opportunity to work with the Department of Defense to assess some of our military personnel who have that disease who are not getting adequate workup. One of my fellows who I trained actually works there. Actually, two of them do, a vascular surgeon and a cardiac surgeon. Just goes to show you how small the world is. I'll be working with this outstanding leadership team, who many of them are sitting right here in the front. Fred Myers, who's here, Heather Young, who we've enjoyed each other's company, Tom, who we've already mentioned, David Acosta, who we've actually had one event together already to do that, Jim Goodnight, who I've known throughout my career as a surgical resident and a surgeon, Chong Porter, who's helping us really develop more philanthropy, and Matt and Rice and Tim Maurice really aren't here today. They're at UCOP at a meeting, but they've been extremely helpful. And Mike Manier, who's actually celebrating an award that he won from the Healthcare Information and Management Systems Society at Davies. All of them have been wonderful. They have amazing track records of accomplishments, and they're sharing information with me, which is so important. Few academic healthcare centers can match the scope and the scale of what everyone in this room has helped accomplish. And ever since I've gotten on the email as I became part of UC Davis, all these wonderful things have happened. We attained our magnet nursing designation. We are a Leapfrog A Safety Score Top Hospital Award. We're in the top 25% of NIH research funding, 34th among 139, greater than $230 million. We won the award, as I mentioned, for the Healthcare Information and Management Systems for Davies Award of Excellence. And the biggest gift so far was the amazing LCME site visit, which was the accreditation of the medical school, where I came back for that, and it was very clear that they called Tom and I the transition team. Linda was over for that as well. And we got just a glowing report from them verbally, which we will plan on getting similar in writing in a month or two. But what a great thing for that. So now we can go forward and do amazing things after the LCME site visit. And then for the third consecutive year, we're the leader in the LGBT Healthcare Equality Award. So I'm going to share with you today just a few personal impressions I've had since I've been here. There is unmatched energy here. There's a can-do attitude. There's such dedication to UC Davis throughout every thread of everyone I've met. You're ahead of many academic healthcare centers, and we really are doing that in many, many ways. UC Davis is just got everything right at the handle. It makes you want to say, why not UC Davis? We have a great opportunity now with a UC integration that we're going to be at the table with all the UCs, and similar to the Seahawks, why not UC Davis? We are one of the most important parts of the UC system, and I will represent us that way every time. There's challenges. I'm chair of the Board of Regents of the American College of Surgeons. I've been working on the SGR and all the other financial issues with accountable care organizations. We're going to be right in there. We're not going to sit on our laurels. We're going to go forward with that. But we're going to do that with teamwork, with core achievements. And I have been so impressed at the meetings where I've been, where the information comes up from the bottom and comes up to the top. The ideas bubble up. People aren't scared to speak. People have ideas. And that the energy comes from those doing the work up to those running the meeting, to those of us that are going to be leading your teams. So I really appreciate any input from all of you, and the meetings reflect that. So I'd like to talk a little bit about teams. I'm a vascular surgeon, as you know, and I've been in the operating room for almost 30 some years now. And teams could not be more important in the operating room. And teams cannot be more important for what we're going to accomplish in research, clinical care, education. You heard Linda talk about the teams that we're going to form from our site to Davis. And all these teams will do amazing things. We'll see teams really identify the future of healthcare and health professions. We'll have education with interprofessional disciplinary curriculum, professors, students. I ran a PA surgical residency in the past. All of those interdisciplines are very important. Patient care also can't be delivered without teams of nurses, physicians, students, the patient themselves being part of their team to take care of them. And for research, my goodness, look at this great program of the hiring investment program by the provost. 17 amazing protocols came from our site, 76 from across the whole campuses. And I can't wait to look at those, because that's where we're going to start creating the teams from both sides, so that we will have great discoveries as we go forward. Many academic healthcare systems talk about teams, but UC Davis does teams, and I was real impressed when I first visited with that, and will continue doing that. All these accomplishments that we've had this year could not be done without teams. And we can't do it with all the departments, without all the departments on this campus as well as the Davis campus. So I'm really looking forward to doing all these things at teams. So looking ahead, I've had some initial thoughts of priorities. You know, I'm 7 days old, so I can have a few thoughts about how I think things are going to come together. And I think the biggest theme is one UC Davis. Fostering collaborations and integration throughout UC Davis to advance our vision of healthcare, a healthier world through bold innovation. That is just a fabulous vision, and I think we can accomplish that. Real innovation happens when our scientists from both sides of the causeway work together and have these wonderful breakthrough discoveries. And I'm excited to work with Provost Ralph Hexter in our joint role as the governing body of the health system to secure and leverage this integration. Our patient care is so important to incorporate a philosophy of patient-centered care in all that we do. We need to make sure that that patient drives everything that we do and what we care about. I would like to start a comprehensive unit-based safety program, which is going to incorporate all of those of us that sit in offices that are trying to make decisions, that we will be attached to parts of the hospital and meet rank-and-file people delivering care, meet patients. We're going to invite Linda and Ralph and all those from UC Davis also to be part of this, so that we really know what's going on with all the patients in the hospital. Leads to better safety, better outcomes, and makes us all be able to speak to each other. We're going to focus on quality of patient care and the quality of the entire patient care experience. We need our patients to feel they got the best from us all the time, for our patients and family and loved ones. So leaders will need to tell stories. I tell a lot of stories. You'll hear those from me, and it will tell you about values. And years ago, my mother actually had an abdominal aortic aneurysm, which is unusual because that's what I study. And for those more senior in the audience, you know, you worry that you will get the disease you study. So here my mother, it's very unusual for a woman to have an aneurysm. Here she has one. She was in a scanner in a small town, and there it was. She ended up having her aneurysm treated at my hospital. And one day when I went to see her, she said, you know, Julie, everyone's so nice to me. The people that clean the room, the nurses, the people that transport me, the doctors. She goes, do you think they're just nice to me because I'm your mother? Or do you think perhaps they're just nice to everyone? And since her name was Doris Freischlag and she looks a bit like me, I was like, well, Mom, they're nice to everyone. You know? But that's what we want to be, that we want to treat every patient like your family member. Now that's assuming you love your family and you're going to treat them nice, but we want them to be so that when they walk in that room, they think that you treat everyone the same. We also need to speak about education. We need to provide an excellent student experience, and the entire healthcare arena is so rapidly expanding and changing, and our students need a whole new sets of tools to be educated, and frankly, they know those things. They know everything about that, so they actually are amazing, and we're going to really work, Heather Young and I together, to work with all our students to make sure that this comes true. I'm a very good teacher. I've enjoyed that all my life. I'm looking forward to getting back into teaching. Creativity and innovation is at the heart of leadership, and we need to inspire daring and innovation thinking within our experience. Philanthropy also is very important. I've met with John Porter many times. I've met some of our donors, and they just are so amazed by everything we do. It's going to be more and more important to UC Davis Health System, UC Davis, and the entire UC system to utilize philanthropy. As I mentioned, I had just been over to the Stem Cell Institute, and they are amazing and well funded by the state, but we know that won't be forever, so we really need to get great donors to help us. That's why UC Davis launched the Campaign for UC Davis, the university's first comprehensive fundraising campaign. It was so exciting and important for UC Davis to have achieved the goal of raising $1 billion, more than 1 year ahead of schedule, and Linda had much to do with that. I've met and spoken with many donors. They're enthusiastic. I'm very comfortable with philanthropy. I just need to know your ideas, what you want, a one-pager, off we go, and those donors really want to help. They want to see something amazing happen, and they want to give. I'm very impressed that the health system is ranked #1 among all UC academic healthcare centers in employee giving, so our employees believe in us as well. And the big ideas, our innovation, will make that happen. I want to give you a quote. I use those a lot. This is from a poem called The Cure of Troy. "Sow hope for a great sea of change on the far side of revenge. Believe that a farther shore reachable from here. Believe in miracles and cures and healing wells." And that's from Seamus Heaney. We can believe in this and go forward and make all our patients' dreams come true. I also would like to say a few words about diversity and inclusion. The culture here is amazing. It's a culture that values and appreciates diversity. Each individual brings something special to the table. This will help our institution accomplish great things, and it will help us with our mission of improving lives and transforming healthcare. Diversity is more than race, ethnicity, religion, sexual orientation, and gender identity. It's the diversity of perspectives, opinions, of talents, skills, and ideas. And we need all that diversity to go forward. We have to lead by example, and I hope to do that, and I need all of you to do that as well. And the way I think the best way to do diversity and to make us feel more included is communication. Transparency, communication, listening, which is not all our strength, and talking, which we tend to do very well. So listening and talking. The key to me when I think about diversity is that different is not wrong. It's just different. And you need to listen to understand how that will make you better. I have never been involved in a diverse circumstance that I didn't come out better because of it. It's the one priority that drives all the rest of ours. And so you'll see us doing a lot of work as we go forward. Lastly, as I close, because we'll take some questions at the end, is that the true measure of the greatness of any organization is how its people treat each other every day. I believe greatness is determined by goodness. And throughout my career, my most memorable joys have been come from seeing people treat each other with kindness, respect, dignity. And there's a sign in my office when you come visit me that says, "Because nice matters." And it does. I always tease my residents that as they left to go off to do amazing things, that the sign of successful residency was when you leave, they actually will miss you. They have the party before you leave and not after you're gone, right? And that when I mention your name later, that possibly bringing you back to work in the organization, that everyone actually would like you to come back. And it's almost that simple, isn't it? That those are the ways you can make sure you're doing a good job. And you can always name one or two things that you did, no matter whether you were a student, a resident, staff, or faculty, that made us better. And as I've left institutions, which I've been at many, the best thing people say to me is, you made us better. And if you can come to work every day and make us better, then we will be amazing as we go forward as UC Davis. So it was real important to me that the first speech I gave this week was really in our ceremony that David Acosta arranged to reaffirm our commitment to the UC Davis principles of community. What a wonderful way to start. And we actually didn't know each other what we were going to say, but we said the same thing. It was amazing to do it. Why? Why do you come to work every day? And we are going to really celebrate over the next year the principles of community. We want to understand and cherish our diversity and inclusion throughout UC Davis. So I really am going to encourage you to participate in the principles of community events scheduled this week here and at Davis. And we're going to really challenge us for the next year, because it's going to be the 25th anniversary of the Principles of Community next year, and we'll have a large celebration. We're going to relook at them and reframe them. I sort of teased everyone, they look like a Dickens novel. You know, it's long, it's beautiful and wonderful, but the new generation, you know, tweets and has bullet points. So we probably need to reframe it in a way that actually reflects our youth. So I'll do one last quote before I'll take some questions, and this is talking about listening by John Fox. It's called When Someone Deeply Listens to You. When someone deeply listens to you, your bare feet are on the earth, and a beloved land that seemed distant is now at home within you. And I actually feel that I'm home within you after a week of listening. You're telling me things I need to hear, good and bad, big and small. And I really have enjoyed getting to know all of you. And over the next few months, I'm going to be trying to visit everyone around. One of my weaknesses is direction sense, and my family will tell you that. So if you see me and I look lost, I am, okay? So make sure you walk up and say hello. It's very nice to see you. Where would you like to be going? I actually walked out of Linda's office at one of her meetings, and actually Ken stopped me because I turned exactly the wrong way to find my car and said goodbye, and he paused, and he said, you probably want to go right. And I go, good. So I really have enjoyed this opportunity to speak with all of you, and so now it's your turn. Let's begin our question and answer session. We have some minutes to do that. We do need to be out of here so that the students come back and learn. We'll want you to raise your hand, and we'll bring a microphone to you so you can ask your question. Both the Chancellor and I are here to answer any questions you have for us. Please remember that we are videotaping this event, so your questions and comments may be included in the video, so that's a disclaimer that we place on the website for people to view who could not be here today. So this is a public forum. And again, I want to thank you so much for allowing me to come and be the Vice Chancellor and Dean. So who would like to ask the first question? Quiet group. No questions? All right, go Bonnie.
Before.
1 second, let's get the microphone to you so we can hear.
Before the recruitment process started and you started, really looking into UC Davis, what did you know about UC Davis? What was your impression of this institution, just sort of from afar?
Great, that's a wonderful question about UC Davis. So when I trained here and I actually went to medical school in the Midwest and then trained at UCLA and got involved in the surgical training program. I knew Dr. Goodnight, Dr. Holcroft, and Dr. Blaisdell. So I knew of the site. I knew it was a huge trauma center. It really served the people of the region, and really it had begun sort of as an outpost because it was new. I had the opportunity to be a visiting professor about 4 years, I think, before I took this job, where I traveled out here, actually met my future daughter-in-law in San Francisco, saw a friend in San Jose, and sort of forgot exactly how far Sacramento was, and drove one Sunday night out here, and was amazed at the growth and the amazing appearance of the campus. And I had actually traveled out to Davis as well, because Laura Marcoux, who's a PhD that works in biomedical engineering, and I had collaborated years before at UCLA, so I had traveled out to the undergrad campus and also had seen the medical center. So I was impressed. I also knew about the recruitment for the new department chair in surgery and had given lots of advice to candidates that were looking at this job in my previous position. So I knew a lot about what happened. So I was impressed by the trajectory of the growth. I had seen and watched the increase in NIH research funding over the time as they moved up. And I was very impressed with the innovation part and the ability to go forward and do things different. So I had recently been and knew that the place was primed to even do more amazing things. Because when you do decide to take these jobs, sometimes you want to take a job that looks amazing and you can maintain. However, the best thing is to take these jobs that there's something to do and that you actually can feel how you can make it better. And so there were things that on this strong foundation, great trajectory, great clinical research program, education innovation, and the campus at Davis with the vet school and the ag school that you knew that there was going to be a trajectory. Thanks for the question. Other questions? Quiet place. Okay, Jim.
I'll take advantage of the surgical connection.
Let's wait for let's get the microphone to do it.
Over the last few years, as you know and been personally involved, the American College of Surgeons has gotten very politically active and was quite influential, I think, in the writing of the current SGR proposal. Brought that together. Perspective on, we have now a new Senate Finance Chief chair, which will probably impact whether this goes forward. Any speculation on what you see coming forward with the SGR?
Right. So the sustainable growth rate, for those of you that aren't actively practicing, is really a system that was a little flawed that was instituted years ago about how to adjust physicians' payments each year according to inflation. And for years and years and years, it has been a threat that it's going to decrease them suddenly, sometimes large amounts, like this was 25%. And they always get repealed and redone. And so every year for the last 8 to 9 years, every healthcare center has had to deal with SGR possible reductions. For the first time this year, along with the Accountable Care Act and the new changes in healthcare laws, some politicians actually brought it forth so that you could actually just repeal it, get rid of this adjustable piece, have us be paid more for value and outcomes, which many of us are going that way, as you know, especially here at UC Davis, looking at how we do versus just an inflationary number. And it did appear, as we wrote letters in December, that that was actually going to happen. And then come January, they did stop it, but again, now it's paused again and wonders whether it's going to come back. Many groups really were very vocal about the fact that we should repeal it, even though there were many groups that were fearful that if we didn't accept that, there were other things that perhaps went along with it that would be beneficial. So we actually, in my group, decided to say it needs to be repealed and that we weren't going to take any part-time fix, that it had to be a full-time fix. I actually think it's going to go away. There was a little flurry, as Jim knows, in the last month of them really bringing it back. A great editorial last week that says, get over it. We really don't want to be paid that way anymore. We want to go towards value and quality and outcomes, and therefore I do think it's going to go away. We are very concerned about how you're going to pay physicians in the future as you look at value and outcomes. Do we have the right metric? Do we have the right analysis so that we know that's going to happen? How do we group people? How does this happen? Because we measure many, many things in the hospital, but we wonder if it actually truly really measures value. So I think that as we go forward, working with many groups in the hospital, looking at our value and outcomes, it's very important. There's no question that now when I'm practicing 30 years after I trained, we actually know what's going to happen. We know outcomes, we know risks, we know many things, and we know how to talk to patients now about what your risks are and chances. Sometimes we actually know the risks are too high and the chance is very low. It's just so hard to tell a patient that there's really nothing we can do. None of us like nothing. We want something. You know, we want some care. So I think the biggest challenge for all of us now knowing outcomes is to make sure we choose the right thing for our patient, choose perhaps not to do something when it's not indicated, and really manage our patient by giving them better education. Many patient groups actually got very involved with this too, because they would like their doctors to be able to do everything they can, along with their nurse practitioners, their physician's assistants, their midwives. They want everyone to be able to do the best care possible and be reimbursed for the appropriate care at the appropriate time. And so I think our next big step, as Jim knows, is really looking at appropriateness. You know, now that we're going to look at value and outcomes, was the intervention appropriate? Was it the correct thing to do at the correct time? And that's certainly where a place like us, UC Davis, is best. We know the right answer, we know innovation, we know how to put it all together in a package to help the patient the right way. Many times they come here because no one else has an answer or they haven't gotten the correct answer. So I think we're really poised to make a difference with that. Other questions? Very quiet group today. Yes, great.
I have a question.
So there, great.
Oh, upstairs.
Okay, thanks.
Right above your head.
Okay, good. Go ahead. Go ahead.
Many of us in this health system are part of multidisciplinary teams, but it seems to be a struggle to get adequate resources and how to allocate those resources. So from my perspective, the reason why I'm involved in a multidisciplinary team is because it's focused on the patient care. But we have a hell of a time getting resources often. How could you help with that?
Great. That's a great question. I think that's the only way for us to go forward to give our patients the best care. So if you wrap what we're going to do around the patient again, that the patient is the center of what we're going to do, multidisciplinary care is the way to go. Multidisciplinary clinics, as well as being available to certain therapies. And you're right, it's very hard to get enough resources so that multiple people can see that patient either at one time or multiple times. I think what we'll be led by are actually these HIP grants. I think we've seen many of them submitted that actually have to do with multidisciplinary care. I think we're going to be very open to listen to ideas about certain disease processes. I must admit, I think I've already seen great examples here when I met with Nancy Lane with the Musculoskeletal Institute, looking at the Stem Cell Institute and how that's going to be progressed over to the Cypress Clinic for intervention with patients. So I think what we'll need to do is to listen to ideas that you all have, look at the disease process and the patient you want to treat, come up with the right site to do that, the right people to do that, and make that happen again with the patient at the center. I'm really excited that all these HIP grants were written because many of them do look at disease process that need multiple investigators and researchers and teachers. So I think we'll be very open to do that. In my previous position, we did have many multidisciplinary clinics for cancer as well as for vascular diseases. So I think there's some start of that here, and I think we can amplify that. Thank you for your question.
Here.
So as you have mentioned in your speech, you said diversity is really important here. Being a student, I can really speak to how essential it is to our training. So I was wondering what are some plans or ideas you have to maintaining diversity throughout the health system?
Okay. So it's a great question about diversity and to maintain, because certainly there's a vibrant nature of diversity and inclusion on the campus. I think the first thing is to lead by example. So I think you'll see me being very active with David as we go forward with this wonderful opportunity to amplify our principles of community. So you'll see me participating and talking about that, including it in speeches and talking about it so it's there. I think we also will reward activities that actually celebrate diversity. So you'll see that happening. We're considering doing more media around the campus so that you can actually see screens and people's faces and activities versus emails, which we tend to all delete and perhaps not read in entirety. I think you'll see some celebrations as we go forward in the next year to celebrate the 25th year. And then I want to hear from you. I think as I meet with the students as well as the other schools and faculty and members, what do you think would help? How would you want us to be better inclusive? What kind of things can we do? Because diversity should be something we do day to day, hour to hour. It shouldn't be just something we do at a dinner. It should be something every day. So I'll want your ideas as well so that we'll be best able to start on this strong foundation and go forward. Yeah.
I think you had a question here first. Sorry.
Mm-hmm.
Welcome to Sacramento.
Thank you.
And congratulations on your appointment.
Thank you.
Can you please share your vision of improving patient satisfaction, improving public perception, and managing our image in as a user-friendly healthcare system in a very complex marketplace?
Yeah, that's a great question. Because as I mentioned, many patients come here because they've been other places first. Some people think you only come to UC Davis because there is no other help. We really want people to come here first for everything, as well as when there's not anything else anybody can do. I think we have to start being patient first, and many of the healthcare providers in the hospital are doing that already. But I think every time we admit a patient, every time we see a patient in clinic, we need to spend that time with that patient, educate them and their families, and really have that energy so that they feel we've given them a great experience. I think that many of us leaders being involved in having more champions in the hospital, physicians champions, nurse champions, those that come to the hospital, actually work with the teams that work not only on the floors but in the clinic, can be very helpful. Again, lead by example. And you have to be there and understand it. We have many metrics that tells us where we have our issues and problems. Some of it's throughput, some of it's waiting, some is because we have so many patients here that want our help. I think transparency and communication and looking at how we do business is going to be very important. Business is going to change. Every year, more and more is outpatient, and therefore the people that talk about us and want to see us or perhaps don't like us may not even be polled in the hospital because they're not going to be there. And the first touch we have is outpatient. Dr. Goodnight's leading a huge organizational change for access, which is very important so that people, if they want to see someone here at UC Davis, it sounds pretty simple, doesn't it? But for those who don't know one of us, it's very difficult, and that has been an issue at every healthcare center where I've worked. And I've really championed that in my previous position to have access so that people get a touch, get a response, get an appointment, first call. And then later on, you can get the details to make sure they're in the right place. Most patients now know exactly what they have and what they do. They're on the internet, they know this, they know that. They actually know exactly. So I think you need to listen more to the patient to make that happen. I have met with Bonnie Hyatt already looking at imaging. If you go online, there's many YouTubes of me. I do a lot of public speaking. You can find me talking about my patients, about diversity. I really like media. I'm more than willing to be out there to be part of our face, to introduce why I came to UC Davis, what the energy is. I think we have a nice window of opportunity to really amplify me being here and talking about that and bringing all the stories, because that's the best thing, our patient stories, our physician stories, so that everyone will know. Today you probably won't remember much about what I said, but you'll remember my mother had an aneurysm because I told you a story, right? Okay, and you'll remember she wondered if everyone treated everyone nicely, or was she mother? You'll remember that. You won't quite remember any of the other awards we won or whatever. So the stories are important. So I'm going to ask all of you to come with me. So when we tap you and say we want to tell your story about this patient, we want you to tell the story about your research project, we want you to tell your story about teaching a student, we want to tell your story about why you came here. There's a great video about students that I saw right before I moved here. I want you to say yes. I want you to say, I'll be right with you, that we can do it, because I think that we're amazing. I think we just need to tell a few more people. And we tell each other because it's comfortable. And it may be a little bit out of our comfort zone, but we're amazing. And if we tell people we're amazing, more patients will get better care. More patients will be safe and get better, efficient care. More amazing faculty will come. More amazing students will come. More amazing nurses will choose to work here. When I was doing my orientation this week on Monday, I sat at a table with 3 new nurses that are brand new grads that are coming here in labor and delivery and in trauma and in cardiology. And they couldn't be more proud to come work at UC Davis. And they told me all the reasons why they didn't choose other hospitals in this city, and I wrote them all down. Little did they know I was paying close attention to that. And part of it was how we treat patients. So even though we're not at the place we would like to be, I think we actually can broadcast that, and I'll need your help to make that happen. Yeah. At least one more, the microphone, Elise. You want to pass it down? Okay, great.
Welcome, Dean Freischlag. My question to you is, you previously were director of the Gonda Vascular Center at UCLA, and we have lots of expertise in cardiovascular medicine at this institution, but sadly they are in silos.
Correct.
On the Davis campus and Sacramento campus. So I was wondering, would this be one of your goals to coalesce all this into a cardiovascular institute, clinical and experimental research?
So that's a great question that speaks to one of my strengths. When I was division chief, we had a wonderful donor, Mr. Gonda, who had given money that I ran a multidisciplinary clinic there, where we actually had interventional radiologists. Cardiologists weren't in that, but they were on another floor, and vascular surgery. As I'm learning, even over stem cells, they're doing wound healing and diabetic feet over on that side. I was in physiology yesterday with Pete Calla, and they're looking at ischemia reperfusion there. So I think I need to assemble all the pieces that we have and then have that occur. I think the more we can put out a clinical, an educational, as well as a research portfolio cardiovascular, I think that would help. Whether or not you need a true institute or whether it can be virtual with all these sites, I'm not sure yet, but I must admit, now maybe they're just showing me vascular because they think I might understand that when I show up, but I have seen lots of vascular at every spot. And so I think once we put that together, I would use your help as well as the others here to help us put that together in packages that are either programs, such as a multidisciplinary program as the previous question, or looking at research proposals. I'm hoping a couple of the HIP proposals actually are vascular in nature, because that will actually show me who wants to work together. And then I think for the sake of our patients, having them come in and get one-stop shopping is important. There's some great interventions going on in this campus, and I think we can make that better. One of the reasons I want to operate and be around is to figure that out, and so I will be there, but I'll use all of you to make that happen. But I do think vascular, as well as cancer, as well as neurological diseases, are many sites, so hopefully we'll be able to pull in all those arenas into one. So I think we can take one more question, or one more question?
There's a question on the second floor.
Okay, and this will be our last one so the students can learn. Okay.
Okay, I was just wondering if you've had an opportunity to develop any priorities for your first year of office, and if you had a chance to meet with Janet Napolitano, the president, on the system-wide level to get any direction in that regard.
Yeah. Well, the first priorities that we are looking at is really looking at population and global health, looking at food and nutrition. And that actually comes from the Chancellor's office and actually is what UC Davis does well. Actually will involve the School of Veterinary Medicine and Agricultural as well. So I think that's one big one. And the second one is really looking at amplifying our educational processes with telemedicine and outreach throughout the community and region to not only physicians physicians, but to patients as well. After that, I think we're going to really look at all your multidisciplinary teams, really enhance philanthropy and diversity, and actually looking at clinical care schemes that actually work well. But as far as specifics, not quite yet, but give me a few more days. I'm 7 days old. In 14, I might have it. I'm just teasing, but I think we'll look at really looking at multidisciplinary teams utilizing not only physicians, but nurses, technicians, all those that make our lives go forward. I have not met the president yet. I was at a meeting where she was a little bit late because the President Obama happened to come to town, and I guess he had her ear and not mine. But I'm sure in the next weeks to months I'll meet her. Those that have met her and worked with her, Tom and Linda, found her very invigorating, and she certainly is professing a whole UC system. That is so important for UC Davis. Having a whole UC system gets us to the table with all the UCs. And the first meeting I did get to go to where there's all the UCs, and Linda was there, and Tom, as well as Ann Madden-Rice, I was so proud of our team. I looked at some of my previous teams since I worked at a few other campuses. Not so much. So I actually really liked our team. I thought we were transparent. We had great communication. We were there to contribute. And so again, why not UC Davis? So we will be at every one of those tables to make sure that we're represented. So we're going to conclude now so that the students can come in, and thank you again very much.